What causes bone spurs in OA bone remodeling? Imagine your joints as busy construction sites. When the protective cartilage that cushions your bones starts to wear down, your body springs into action. It perceives this as damage and begins a repair process called bone remodeling. During this process, special cells in your bones called osteoblasts are stimulated to produce new bone tissue. Over time, this extra bone growth can develop into what we call bone spurs or osteophytes. These spurs are like tiny bony bumps that form at the edges of your joints. In osteoarthritis, the cartilage that normally acts as a shock absorber begins to break down due to aging, wear and tear, or injury. As the cartilage wears away, the bones underneath are exposed and start to rub against each other. This friction triggers your body to respond by trying to stabilize the joint. It does this by depositing new bone tissue around the edges of the joint, forming these bony projections. Think of it as your body's way of patching up a worn-out fence post by adding extra material to reinforce it. Inflammation that often accompanies osteoarthritis also plays a role. Swelling and irritation in the joint send signals to your body to produce more bone tissue. This process is meant to protect the joint but can sometimes lead to painful bone spurs pressing on nearby nerves, tendons, or ligaments. Age is the biggest factor in bone spur formation. As you grow older, your joints naturally experience more stress and damage, making spurs more likely. Genetics can also influence how quickly your joints wear down. Past injuries or repetitive stress from activities can accelerate this process too. Obesity adds extra weight and pressure to weight-bearing joints like your knees and hips, increasing the chance of spur development. Bone spurs tend to form where bones meet in a joint or where tendons and ligaments attach. Common areas include the spine, heels, knees, and hips. While many bone spurs cause no symptoms, some can press on nerves or tissues, leading to pain, stiffness, or tingling sensations. Most bone spurs from osteoarthritis respond well to non-surgical treatments like pain medications, physical therapy, and weight management. When these measures don't help and the spurs interfere with joint function, surgery might be considered. In essence, bone spurs are your body's way of trying to stabilize and protect a joint that is slowly breaking down. Recognizing early signs and managing osteoarthritis can help slow down this process and keep your joints healthier longer.